The Philippines, a measles outbreak has already killed more people this year than all of last year. Health officials say at least 261 people, mostly children, have died in 2019 alone, while 2.6 million children in the country are at risk of contracting measles. The International Federation of the Red Cross and Red Crescent is working with the Philippines Department of Health to immunize children across the country's hardest hit regions over the next year. Let's bring in Philippine Red Cross Chairman Richard Gordon. Richard, thank you for joining us. Why is this happening now? When the vaccine has been out there for years, widely available, why are we seeing this outbreak?
Totally unacceptable, particularly in the Philippines, although it's happening in other parts of the world. In the Philippines, this is happening because I think we've been very lax in terms of the vaccination program, but it has been dramatically exacerbated by the fact that there was a largely untested drug, which was even, clarified by the sellers of the drug called Dengvaxia that it could cause harm. In the process, many deaths occurred, and it was blamed on that drug. So many of the parents got afraid to bring their children or to allow their children to be vaccinated. Not to mention the fact that in other countries, there's a campaign against vaccination, which I think is totally unacceptable.
Yeah, there seems to be two issues here. One is boosting vaccine confidence. The other one is just getting kids vaccinated. We're reporting that 2.6 million children in the Philippines remain at risk. How do you plan to immunize all those unvaccinated kids?
Well, the Department of Health is doing its level best now. It's trying to close the gap. We are also helping out. I just met, for example, with the midwives, the doctors, the nurses. We're getting our acts together. All our volunteers are on the ground. We're now on 7 provinces, and we've already vaccinated about 12,600 plus people. And I think as we go along, we were in the Visayas, in the center of the Philippines the other day, and we're going to be in other parts of the country. So we're addressing this as quickly as we can.
Good to hear. And that's the other part of the battle, is trying to get rid of that skepticism and restoring vaccine confidence. We know confidence fell, as you mentioned a moment ago, after that dengue fever vaccine scandal of 2014 in the Philippines. How do you rebuild the trust after something like that?
Well, we are telling people that these vaccines have been there for the last so many years, several decades. They've been tried and tested. One Dengvaxia should not ruin the case. And, a lot of people are dying, and they're getting scared because right now there are more deaths in the first 2 months than in the deaths last year. Last year we only had 202. Now we're at 261. There are more cases, 380% rise in cases. So we're spreading the word around, and we're trying to get more people to understand this problem.
And Richard, just the fact that measles cases are spiking, not just in the Philippines, but around the world, does that anger you as a public health official?
Oh, definitely. I'm a volunteer for the last 50 years. Yeah. And I'm chagrined. I'm totally crying for, something to wake everybody up from this stupor. I'm reminded of the 1917, fatal disease called flu, where about 50 to 100 million people died, and the world hardly even realized that it happened. And we should be learning from these lessons. And it could be any number of diseases that can occur. Tuberculosis is on the rise also. And we're looking at polio, and we're looking at other things. So we want to be part of the solution. So we will continue to do so.
Well, good luck with that. This is a wake-up call. Vaccinate your child. Richard Gordon of the Red Cross, thank you for joining me.
Thank you very much.